Good day, my dear undergraduate and postgraduate students. Welcome to this special class on VIVA VOCE and the method of preparing for the examination. It comes from the Latin word which means oral examination. Often, it's a part of the university examination as well as the class test, both for undergraduates and postgraduates. Sometimes it can be elaborate, as in the case of a postgraduate after the examination of his thesis by the panel of examiners. Both the externals and the internals have got an important role to play in this. And personally, as I said, there is no time limit for the postgraduates. There are various terms which are usually thrown at the student, mainly the undergraduate. The definition, etiology, pathogenesis, gross microscopy, investigations, differences, and complications. Where at the other subjects, the terms will be varying accordingly. For example, what is the indication? What can be the complication? What can be the differential diagnosis? And what is the clinical mode of onset? So on and so forth. Please do remember that all these subheadings are not applicable to all the topics. Pathogenesis, for example, is a detailed description of the development of a disease, which can occur in questions like iron deficiency anemia, megaloblastic anemia, etc., but not in renal cell carcinoma. There is a picture on the screen. I would like you people to kindly guess the questions that are probable or possible. And this can be the panel of questions or even more, depending on the way the student answers and the marks the examiner wishes to allot. So these are various things. It can vary again. It can be more extensive or more summative. As I told earlier, the word means by word of mouth, orally. Latin phrase means it is literally a living voice. Viva voce means it is a living voice. I always adore this particular specimen, courtesy Maud Abbott from McGill. So this is a superb specimen of a typhoid intestine. But then the questions can go in any direction to any extent, depending on whether you are a borderline student or a gold medalist. There are certain blunders in the preparation for the exam by the students. The first and foremost is being unprepared. Any of this comes after repeated rehearsals, anticipating questions, sometimes trying to copy the questions that my preceding student has had, taking it for granted, thinking that it is only a ritual, selective reading. I read tuberculosis, I will omit leprosy. Misjudging your colleagues. Normally, all the students will be in a state of panic. So I think that they are equally unprepared as me. But the reality is not like that. There are some students who will be very fluent at the Viva, which will be not known to their colleagues. Being too smart, literally trying to outsmart the examiner. This is one of the colossal blunders. A bad student can pass, but a student who is trying to outsmart the examiner will have to pay the penalty. Irrelevant answers. Again, taking it for granted or thinking that it is only a ritual. If you do not know, pass on so that you go to the next question. This is a beautiful saying I got in this context. When you take things for granted, the things you are granted get taken. So you can understand the meaning. A beautiful saying, I would like you people to kindly memorize it, judge it, and pass it on to others. There are some psychological problems concerned with the vibe. All of us are aware of this. Naturally, there will be an element of anxiety. You are in a totally different atmosphere. You are facing a different person under different circumstances. You are under peer pressure and so on. Sometimes we try to be too perfect. This is again what I had explained in my colleagues and students over the past decades. So much so that even refrain from coming to the exam because they feel that they are a little short of perfection. Arguing. Naturally, students are very political nowadays. They do not argue. But then this can be a catastrophic blunder. Confident with the wrong answers. This is again a way of arguing or taking it for granted. So please be careful. These are certain things we should not be caught in. And what is this one? Imagine that this is the examiner and he has got something in his mind. And I am trying to read the mind of the examiner. Looking at the eyes of the examiner and then with a face of sympathy or empathy, trying to get the answer from the examiner. Many of us really cherish this scenario, but a genuine examiner will not budge. There are some general features in a VOCE. It is not only the answers, your personality, your aptitude. What are the circumstantial factors? Sometimes we correlate with the theory question paper. If it is too tough, then we give another chance. Flexible. It varies from the weak to the strong. It has to be progressive. According to me, the mark is decided by the point where you are not able to answer. If you are not able to answer a very difficult question after a long time, that means you are in the 60s, 70s or distinction. The examiner is in direct contact with the student. Therefore, he can deviate and ask what the interactive skills, all the levels, that is cognitive, psychomotor, affective, which means recalling what you can do and what you can think about. All these can be judged in a vibe. Different objectives can be tested. Abilities. Classification, for example, or the structure of a particular lesion. What are the merits and demerits? And there are some strategies which have to be improved. All VIVA and all VIVA questions have got their own merits and demerits. And therefore, a repeated rehearsal is needed, which I shall be telling you about later. Now, there is an exam specimen on the screen. Can you guess the panel of questions? Imagine you are an examiner or a senior faculty. So the marks can be allotted for anything. Do not by heart one or two questions that are given in your charts of food. That will be colossal and it can be catastrophic. Identification, points in favor, differential diagnosis. What are the other instruments that you can use? What can be the indications, complications, advantages, so on and so forth. It will go on. This is the purpose which I had mentioned earlier. Sometimes performing under stress, that is also assessed, particularly if there's going to be a prize exam or you're going to be allotted a distinction, then it is possible. Professional competence, when it is going to be an interview, or a selection for a higher course, or sometimes a posting. Sometimes your values, enthusiasm, genuinity, they are all being studied. We are not aware of most of these things. This is one thing that I like. This is a story of a very mediocre doctor who was born in a very poor family who ascends the ladder of career. And that is why the book is called The Citadel. In the final examination at the Oxford University, he will be asked a series of questions which he will be answering, rather rattling. Then came a question about which is so and so. And he gave an answer. The examiner did not agree and said, the latest journal, it quotes it otherwise. The candidate simply said, I beg your pardon, sir, the latest journal quotes this. And the issue was available in the library. It was brought, and then the candidate was found to be correct. That is the story of A.J. Cronin, The Citadel, which you people must read. Experience matters on both sides. For the students, we always tend to segregate because we want to make things very simple. I always say theory, viva, practical, and clinical go hand in hand. Do not segregate one from the other. Sometimes we hesitate and the examiner gives us a lot of clues. At the end, we answer. But then we must remember that hesitation and prompting will be time consuming. It will be costing us points. Similarly, the examiners also should be mature enough to assess the candidate and then go progressively and should not be jumping from topic to topic and from level to level. Once again, guess the panel of questions. This is a chart, this is a slide all of you people know. You will be able to make a diagnosis. But then, if this is given as a chart and the examiner can ask anything, starting from the diagnosis up to the investigations, up to the complications and so on. What are the other hemolytic anemias? Anything. The greatest fool can ask more questions than the wisest man can answer. You can, because tomorrow you are going to become a teacher and an examiner, sometime in some subject, not necessarily in pathology. An expert knows all the answers if you ask the right questions. So who is the expert in this case? It is the candidate. And it is the duty of the examiner to ask the correct questions. A beautiful quote in this context. Structured viva, which means there are other things that are being assessed than merely the objective questions and answers. That a written page can be given. Here, your fluency, your confidence, body language, etc. And in order to avoid bias, a rating scale can be used and the marks allotted accordingly. Finally, the examiners as well as the students should try to get a feedback from some of the observers or the colleagues so that they can improve in future. A repeated planning and reevaluation will be needed. There are some shortcomings in the VIVA. These are some facts about VIVA. Lack of reliability. Based on this alone, a candidate, whether he can be passed or failed. That is why if it is done as a group, one examiner will not be overdoing or underdoing. Similarly, the question should be equally distributed among the examiners. This will avoid an inter-examiner variability. Variation can be by means of the team, by the time and the tenure. Naturally, you would have observed that the first candidate gets the maximum number of questions and the last candidate almost a telegraphic vibe. There can be a tendency towards partiality, a subjective element, and leniency. These are certain shortcomings. That is why the objective type of exams came into force. which we shall discuss at a later date. If your life was a book, what would the title be? If your life was a book, what would the title be? And this is a question, I presume, and your answer is, if my life were a book, then the title would be so and so. An amazing question and an answer from No One Cares. Techniques during the VIVA. The examiner will have to plan the tactics for the difficult candidates. Bringing out the answer is also an art. The poor candidate, poor in the sense in the subject, having some kind of defect in communication, should be encouraged. There should be a non-verbal encouragement also. A quiet and a smile might do the trick. More topics will have to be covered. If a student does not answer a particular range of questions, simply harping in on the same topic will seal the fate of the student, and it is wrong. Now, there are certain facts about VIVA. I have underlined the main ones. The speaking time of the student during the examination. The more the examiner talks, it is inversely proportional to the marks I get. That is the percentage of the time used by the examiner. Sometimes you find that there is no correlation with the student's marks in the other exam and the VIVA, which means the VIVA is a totally different one, which should have a lot of communicative skill, a presence of mind, and a broad breadth of knowledge. The merits. The cross-section of the entire subject can be studied. Your understanding of the subject is also tested, a concept of it. Both the individual as well as the problems in the testing are again being tested. The teaching methods, whether it is effective or not, could be found out. And valuable and immediate feedback from the students will give us the thing. Ask the right questions if we are going to find the right answers. Again, when is a red grade? Superb one, I think. The face speaks for itself. A very great teacher of tribute. There is something called as a structured VIVA. It is a lesson to the examiners, not only the students, but also the examiners. The question should be clear, short, precise, unambiguous, unequivocal. It should cover all the subtasks or topics in a proper sequence. Start with the definition, etiology, then finally the differential diagnosis. Test the different levels of knowledge. It can start with a direct question, then probably a scenario also. If a patient were have to have this and all, what would you do? Standard set by all examiners. There has to be always a panel of questions. Many of us do not follow it, but this will be ideal so that we do not deviate, and also we do not have a difficulty in the flow of questions as examiners. A standard marking system also should be there so that there is no subjectivity. As I said, you will have to assess the various factors such as the circumstances, interactive skills, and the various domains. It should be flexible, ranging from the weak to the strong. Reliability. When a student has completed an oral assessment, can we be confident that he will be doing equally well with other questions? I do not know. I asked tuberculosis, he answers. But then I asked something else about syphilis, he doesn't. He may not be knowing, but I will not be having the time. In a different scenario, for example, there is a single examiner or two examiners, an internal examiner and external examiner. Assessed by another colleague, I ask the questions, and then a colleague of mine asks another set of questions. Will it be the same? Will it be reliable? And when it is being done at another time, will it be almost equal? So in short, another question, another scenario, another examiner, another time. All these should be constant. There are certain shortcomings. As I told you, there is a limited time, particularly in undergraduates. We will be hardly having about 3 or 4 minutes at the most. Even 3 is a little too much. And there are limited questions which are being asked. Sometimes there can be a prejudice by the examiner. Inconsistent questions which are not relevant to the subject, and sometimes it can be based on my mood swings. Subjective, whether I like the student or not, is being reflected in the VIVA. These are all some of the shortcomings. The wise man doesn't give the right answers. He poses the right questions. Again, a corollary of another quote that I had mentioned. Thank you for your listening. I hope that this will be extremely useful. Please analyze it again and again.